Welcome to Healthy Frontiers. My name is Dr. Bisogni. I'm a chiropractor, and this show is dedicated to the education of our viewers. The topic for tonight is Pilates and your health, and my special guest is Marilyn Miller. Marilyn Miller began her ballet training at the Dallas Metropolitan Ballet School. She continued her training at the University of Utah and performed professionally as a corps member with the Ballet West and the Eugene Ballet. She was a guest soloist with the Santa Clara Ballet and Peninsula Ballet Theater, both in Silicon Valley, and was a soloist dancer with the San Francisco Opera Ballet. Ms. Miller was introduced to Pilates in San Francisco at the Center for Dance Medicine at St. Francis Hospital, which was the first medically based Pilates program in the country. Impressed at how the deceptively simple movements in Pilates were able to heal her injuries, increase her strength, and also her flexibility, she became a STOT Pilates certified instructor upon retiring from her professional career as a dancer after moving to New York. She is also an American Council on Exercise certified personal trainer, and her expertise is in both orthopedic, post-rehabilitation, and dance injuries and prevention. Ms. Miller is the owner of Pilates On Hudson in Peekskill, New York. So I'd like to welcome Marilyn to the show.
Hi.
Welcome, Marilyn.
Nice to be here. Thanks for having me.
Our pleasure. Marilyn, let's start from the very basic. First, tell us a little bit about Pilates. What exactly is it, and where did it begin?
It is a style of exercise that is a multidimensional form that incorporates total body engagement, breathing, concentration, precision, flow into a very unique hybrid. It was started by Joseph Pilates back in World War I. So a lot of people think that it came about recently and was like kind of a fad thing. Actually, it was started about 100 years ago in World War I when Joseph Pilates had been interned in a prisoner of war camp and was working with injured soldiers, trying to figure out how to keep them healthy, even though they were kind of, in World War I, they were put up in traction beds and all that stuff. So he was trying to figure out how to keep them healthy. He took his knowledge of calisthenics and of yoga and a whole bunch of things, put them together and said, let's try this. And that's how it became Pilates.
That's how it was born.
Yeah, that's how it was born.
There were many injuries in that World War I, I'm sure, that nobody's had ever seen before.
Right, and what they would do is they would just take the guys and kind of like, oh, your arm's hurt? There we go. And so they'd be hanging out in a hospital bed in traction, and Pilates would be like, well, you can't just sit here and do nothing for your whole life. And he came to that because he himself had been rather sickly as a child. So he became very physically fit and very active and pursued a lot of different ways of moving. Supposedly he was a boxer, he did circus stuff, he did some yoga, he did calisthenics. I mean, he really kind of delved into a little of everything. And he saw how much better it made him feel to be exercising and moving and controlling the body and stuff. So that's
so novel back then in the 1900s, huh?
Yeah, it really was when a whole lot of stuff was just kind of coming, to the forefront. But he was unique in kind of putting everything together.
That's great. So what makes Pilates so different from other exercise techniques?
The main thing is the focus on the core. So, and it's not just, like you think, oh, we go to the gym, I can do core work, I can do my crunches and all that kind of stuff. But it's really making sure that you have correct muscle engagements. It's making sure that you're working your deep transverse abdominis. So you've got 4 layers of abdominal muscles. A lot of people go in and they think, I've got my six-pack. I want to work the girdle, which is underneath everything, your transverse abdominis, and my obliques, and my six-pack. But I also want to make sure that I've got my serratus working, my serratus anterior, which hold my shoulder blades in place, and my glutes, and my hip flexors, and it focuses on all of that. And then when we talk about doing anything on the equipment, so when we're doing the mat exercises, there's 2 types. There's mat and there's equipment. So most people may have done or been familiar with a Pilates mat class at a gym. And that is where you lie down on the floor, you'll come all the way up and touch your toes, you'll lie back down, you'll roll over, you'll sit up, you'll do some twists, you'll do some leg lifts and all this stuff. The purpose of that is you want to kind of go through the exercises again with this precision and flow and concentration. Breathing is also a very big element to it as well. But then we can take it on to the Pilates equipment.
Right.
And there, what makes it really different from a lot of other things is the fact that it uses springs for resistance as opposed to weights or pulleys or hydraulics in any way.
Interesting. Great. We're going to look at those in a few moments,
Yes.
right? So,
Yes,
okay.
absolutely.
So what's the most common thing that you hear people say about Pilates after they start the program?
Again, going back to the focus, the precision, and everything else,
Yes.
people always say that the number one comment is always, I really have to focus. I really have to concentrate.
Right.
And that's one of the things that really makes it different too, especially so many times you go to a gym and it's all about distraction.
Yes.
You know, there's TVs, there's this TV, that TV, that TV, the music is blaring, or you can bring your own headphones and listen to your own music and watch TV, and there's 1,000 people and bright colors, and the gym comes at it from the perspective that you do not want to be here, so we want to do everything we can to entertain you and distract you from the fact that you're actually here exercising.
Right.
Pilates is the complete reverse of that. There are no TVs.
Right.
You know, if there's music, it's off in the background and it's not going to be in your face. Nobody has their phone with them in any way. And it is incredibly focused and concentrated and controlled the entire time. It's all about getting in touch with what your body's doing.
Very close to, I'm thinking meditation, yoga, more so than going to an exercise facility.
Right, right.
You know.
And in fact, he actually drew, when he was creating this technique, he actually drew a lot from yoga and from meditation. And so there is a component as you're going through it that you need, I mean, there's so much stuff that you have to be thinking about. It's like, okay, you've got your abdominals, you've got your pelvic floor engaged, and at the same time, your rib cage are in the right place and you're breathing the right way. Now make sure when you're doing arm movement that your shoulders are not coming up to your ears and you're not rounding forward and you're not arching your back and you're not clenching your toes, and there's just so much to go through your head.
Sure.
I can't imagine how anyone would be sitting there thinking about something else. They try, but usually we're like,
Get back, come back.
smack.
Yes.
So.
Great. So we just talked about springs.
Yes.
Which goes back to the Pilates situation
The
in the
equipment,
hospital
yes.
beds that
Yes.
there's all we had
Right.
to work with.
Right.
So tell the audience more about the equipment, how it's different from, say, a typical machine you find at the gym.
Right. So again, he first started doing this when he was working in a prisoner of war camp in the infirmary there. So if you think about what an old-fashioned hospital traction bed looks like, that had like the big posts, you know, with the bed and all that kind of stuff, you know, and whether he worked with that or whether it was another kind of bed, but he wanted to figure out a way to let the guys get some kind of exercise. And back, you know, this is when the beds they were sleeping on literally were these old springs that they would just throw a mattress. They didn't have a nice platform bed or a box spring. It literally was interlocking springs with the mattress on top of it. So Pilates was like, well, let's see. What if we took the spring and what if we put a handle on it? And what if we somehow hooked the spring to the back of the bed? And so now, grab a hold, you can pull the spring, and all of a sudden, you've got the ability to do some kind of exercise. And he has, so then he used both short springs, and then we have another one here that's a little bit longer, you can see. And so this he would use, and you would put your legs in that. And so now you could do some kind of leg work as well from that. Once he did that, he just kind of left it up to his imagination in terms of what to do with the exercises. So.
Right. Perfect. What is this here? We're going to get to this later.
So
This is an interesting piece right here.
Exactly.
Go ahead.
So this, if anyone's done something at a gym, they may have seen people using this. I always say this is the original Thigh Master thing here, but this is from Stop Pilates. This is called the Fitness Circle. The Magic Circle, you know, there's a lot of different names for it. Basically, it's just a tension-resistant ring that you can do some easy strength training with. You can do arms with it. A lot of times you'll have it between your legs to help engage your core muscles. Sometimes we'll have it between the ankles if we're doing something. He originally, the story behind this is originally this came from the ring around the small keg of beer.
Oh. I could believe it.
Yeah, so he really, you know, it was one of those things. I mean, he just kind of looked around. I would love to I would love to have been there to kind of see, because you can see his mind was just so ingenious in trying to figure out, like, what can we use, what can we use, and what do they say, like, necessity is the mother of invention. So he just picked up what he could, and then over the years, over the past almost 100 years since he first started doing this, the companies, there's a number of different companies that make the equipment. They've changed little things, so maybe, the metal that we use for this isn't quite the same gauge as the metal that was originally used.
Right.
Maybe the design of the equipment is a little bit different.
Right.
Just slightly.
Right.
But for the most part, we've really held to exactly, the standards that he set out 100 years ago. And I think that's unique, because I think a lot of the fitness equipment, when you go to a gym, talking about some of the differences, a lot of the fitness equipment at the gym, they're always trying to come up with, oh, we did it this way now, and we do it that way, and it's all computerized, and put a program in, and all this stuff. The other thing with Pilates is it's not computerized, it's completely mechanical engineering.
Right. Keep it simple.
It's one of those things that when you look at it, you're like, what do I do with it?
Yes.
And there's no instructions.
Right.
So it's hard to come in and just sit down on a piece of equipment and say, I'm going to start exercising, because it's one piece. It's not like a gym where you have 10 different pieces of exercise equipment. It's we have actually 3 pieces of big equipment.
Right. Okay.
So,
if we have time, we'll talk about that.
Okay.
Reformer. Okay. I heard people say it's like yoga. So is it? We touched on it a moment ago, but why don't you just explain that a little bit?
It's yoga with dynamic resistance.
Right.
So if anyone's familiar with yoga, one of the most common positions that you do in yoga is called a downward dog.
Yes.
If you can imagine doing a downward dog, except now you're on a moving platform.
Right. Okay.
And depending on how many springs we put, so the piece of equipment you're on is called the reformer, and it's like a bed that the carriage moves and all. So if you're doing that downward dog, we can put a lot of spring tension on, and that's going to force you to really work into the glutes to press the carriage out and then resist it when it's coming back in.
Right.
Or we can put very, very little spring tension on, have you lift up on your tippy toes, and now it's going to be all about working into your arms and your back to make sure that you just don't go flying away, and working into your lower core to pull the lower legs in.
Great. Okay. So you said that this is part of your rehabilitation when you were dancing.
Yes.
Right? Is it considered physical therapy?
It's not physical therapy the way that we think about physical therapy now. When he first started, it very much was. But both, physical therapy has really progressed in the last 100 years. So now physical therapy has a tendency to work much more in the acute phase of an injury, as opposed to any kind of long-term chronic thing. And you understand this as a chiropractor. So it can be used in what's called orthopedic post-rehabilitation. I do a lot of work, what I'm affectionately calling prehab. So for people who there's something wrong, but they're not at the point that the doctor says you need physical therapy. So it's very preventative in that sense. And it's also rehabilitative after you've been released from the acute phase of PT.
Right. Makes so much sense.
Yeah.
And what kind of injuries and other issues have you worked with
Everything.
Pilates?
Everything.
From low back pain to...
Probably the biggest thing we see is chronic low back pain.
Okay.
But we have done a lot of work with shoulder issues, rotator cuff issues, a lot of work with hip replacements, knee replacements, people wanting to avoid hip and knee replacements, ankle issues, foot issues. I mean, really.
So someone has surgery on their knee, for example, they go through their physical therapy, of course, for a certain period of time, and now they're ready for you afterwards, right?
Right. Or a lot of times they'll come in and they'll feel that, something will be wrong with their knee. And like I said, they're not quite, the doctor's like, well, if something doesn't change, maybe you might need a knee replacement down the line.
Right.
So we start working with them, seeing if we can, really looking at the whole body. I mean, one of the biggest differences between Pilates and physical therapy is physical therapy tends to focus on one specific thing.
Yes.
So if you go to PT and you say, Doc, my shoulder hurts,
Yes.
we're going to work on your shoulder. We're not going to do anything to look at the whole kinetic chain
Right.
and see how that relates to your back and your hip and your knee and your foot and everything else.
Right.
So as a chiropractor, you know it's the whole body.
Yes.
It's not this, but our insurance company looks at it from a one joint perspective. So we'll come in if someone has a knee issue and start addressing the entire body to
Right.
see what needs to be worked on.
Okay, so you were a dancer.
Yes, I was.
All studios run by dancers?
There does seem to be a preponderance of studios that have dancers involved with them.
Okay.
We were the original people to find Pilates when he first came from Europe to New York and set up his studio. Right. He first set a studio up in the 1930s in Manhattan. I think it was on 56th Street.
Yes.
Is where it first was.
Yep.
So a lot of dancers from George Balanchine, who was the founder of New York City Ballet, a lot of the dancers at his company, and also from Martha Graham, who really founded American Modern Dance. I don't know who originally said go here, but they ended up going to Pilates. And they just found that it was hugely beneficial. One of the main reasons being that when you look at any kind of professional athlete, you have to have a kind of extreme range of motion just to get in the door.
For sure.
And with any athletic endeavor, what they then do professionally is they say, let's take that so you can stick your leg up here and let's do this more. Yes. And now bend over more and more. And basically, like, they push you to the extreme. So what Pilates really does is it takes that hypermobility that so many dancers have, and because of that dynamic resistance, instead of just pushing out and stretching as yoga would do, or just that constricting that weightlifting would do, the combination of the both of them really helps to, in essence, kind of attach the limb back into the body, so that you're able to really stabilize even in an extreme range of motion. So whether you're kicking or throwing or turning or anything else, you're able to pull that into your core and feel connected. So long story short, that's why, since so many dancers then, if they've danced professionally, will have taken advantage of Pilates, we often will see this as a stepping point. However, that does not mean that they have to be run by dancers. It's just a lot of dancers do.
Right. Gotcha.
Yeah.
So you emphasize the dance aspect of it, but it's available for anyone to do,
Yeah,
right?
no, absolutely. I mean, we tend to go into it just because it's something we've done and we know, but anyone can go and take advantage of it. You do not need to have any kind of a dance background or dance training.
Right.
It's advantageous, but it's not necessary. We really work, a lot of times people always say, Pilates is very hard to do and it's very challenging and I'm very intimidated by it. That is, I would say, keep looking at different places and different programs.
Right.
Some places do work very intensely, so it's more like a fitness routine.
Yes.
But other places, like my own and a number of other studios that are focused more on the rehabilitative aspect of it, want to make sure that you learn and that you understand. So we're going to take you from basically your 0 point, as I call it.
Yes.
And really start to teach you, how to engage, how to fire your muscles.
Yes.
What your correct muscle firing pattern should be. I mean, we look at a whole lot of stuff.
Right, and I'm sure you're in contact with these clients, doctors many times, chiropractors, medical doctors, orthopedics. So in case you need some information that they know that you're working with them. So everybody's in harmony to get the best result.
We do our best to do that, yes.
Right. Okay, great. So that seems to apply to different ways of doing Pilates. Is that the case?
Yes. So, like I said, so there's this kind of fitness side, there's the rehab side of it. Pilates, you can also look at the same thing like with yoga, which now has a number of different branches to it. And you can say you do Hatha or Iyengar or, Jivamukti or like all these different kinds of yoga. Pilates is kind of becoming the same way. There's different branches of it. It started with what's called classical Pilates.
Correct.
And that was based on a number of assumptions that Joseph Pilates had about how to work the physical body.
Right.
And there's a whole school of thought that still wants to stick exactly with what he was doing and work that way and his order and believes in that. There's another one that is a little bit more athletic and fitness-sized, and kind of let's look at this as an exercise technique, and we're just going to go through this motion, work up a sweat, get a good workout in. And then there's another side, really referred to as contemporary Pilates. That's the more rehabilitative side of it, which is where I practice. And that's, like I said, that's the one that is really wanting to break down what's going on with you and work in a very corrective way.
That's great.
Yeah.
That's great.
And I have to say, the main difference between the contemporary Pilates and the classical Pilates is we really incorporate in the contemporary Pilates just a lot of stuff that we've learned about the body, a lot of biomechanical understanding that he just did not have. I mean, Pilates passed away in 1967.
Right.
So a lot has changed in the medical world and our understanding of the body and movement and kinesiology since then. So we want to try and work a little bit with a more current understanding and science.
Great. If someone has never done Pilates before, how do they get started? Can they just show up at a class? Hey, I want to do Pilates.
It depends, because like I said, there's a couple of different types of classes. So if you wanted to come and do a mat class,
right?
I would probably say you don't want to go to an advanced mat class because that might be very intimidating. But you would always want to look for maybe a beginning level mat class. Absolutely can show up. If someone is coming because they have some kind of back pain or an issue, whatever it might be. We offer a lot of private training, so we strongly encourage people to come and start by doing private lessons. I myself, at my studio, we do a whole postural analysis, we do a health history review, we do muscle strength testing, gait analysis, really look at you and develop a personalized program. So we can, especially if you're coming, post-op or post-rehab or anything else, we're able to put together a program that's really going to get you back to health, and that's the whole purpose of Pilates was return to health was what he was looking for. I think a lot of people don't understand with physical therapy is that physical therapy really only takes you to 80% of recovery from an injury or an issue, and it's up to you to do the next 20%. And how your physical therapist or physician or whatever might gauge where that 20% is for you, it's interesting. I've seen some people in some very, what I would not consider, post-op, post-therapy positions come walking in my door, and I'm like, okay, so I'm surprised you were released with this, but let's go.
Let's go.
So,
Great.
Yes.
Right. Good. Okay. So have doctors, chiropractors, or physical therapists had a hand in developing any Pilates program, or is it all put together by non-medical professionals?
Originally, Pilates did not have any formal medical training.
Right.
He just had a very creative mind, and like I said, had studied a lot of these different techniques, and somehow in his brain he understood weight and force and trajectory and all that stuff. I mean, one of the things I was going to talk about, like the I don't know if we have it on there, but the springs, that's so different for him to use and decide to use springs is the different forces that are at play in a spring and how all of that works.
Right.
Anyway, back to the question about doctors. Originally, no, but as people have started to see the benefits of it, they definitely have been involved in it. I mean, like I said, I was fortunate enough to have learned this at the Center for Dance Medicine in San Francisco, which was the first medically based Pilates program.
Yes.
There's a program that I did some work with one of their main instructors now when I was in California, and the program Balanced Body, their entire training program was developed by a chiropractor. There was, I think there's a couple of other ones that were developed by chiropractors as well. But so, and now a lot of doctors all across the country, physical therapists recommend it. It's very much incorporated.
Seen a couple of my patients with fabulous results, so I'm very happy for that and grateful. Thank you.
Yes.
Right. Is Pilates covered by an insurance company? That's always a big question. Well, is it covered since it's going to be in the rehab world, possibly? How does that work?
Yeah, it completely depends on what the setting is. So if you're doing Pilates in a doctor's office or in a physical therapy center, it may be.
Okay.
I can't say it will be, but it may be. Right. But if you're just coming to see someone individually, unless you've got like a health savings account or a medical savings account, your regular insurance is not yet yet going to cover it.
Right. Hopefully soon.
I would love for that to change, but
Oh,
right
yeah.
now, no.
I mean,
Yes.
you see patients from Dr. Metzel, and it was a world-renowned
Yes.
hospitals for special surgery.
Yes.
Right. I mean, and some of these people are not covered, and some are. Right.
I know.
Yeah, it's
Absolutely.
insane.
I know. It doesn't make
Okay.
any sense.
I mean, you even see people from Berkeley Rehab right here in White Plains. I mean, we get a lot of people from those kinds of institutions, right?
Yes. Yes.
Okay. Right. Can anyone get certified to teach Pilates? Or what should someone look for when they are looking into working with someone?
Unfortunately, yes, anyone can get certified to teach it. And it used to be that there was a little more of a screening program behind that, where they wanted to make sure someone had some kind of background or experience, but they realized that certifying is a big business.
Right.
If you're going to get trained, or if you're hiring an instructor, just look into their background. Make sure it is at least a 500-hour training program that they've gone through.
That's great.
It should take them a couple of years to do it, not a couple of weekends. If your
Right.
Pilates instructor says that they did a weekend course or they did an online course, keep
Fun.
walking your fingers in the yellow book and find someone else. Yeah.
Okay, great. And just as a last question, can children do this? I mean, I have this question. How young can anyone start the Pilates program? Are there any criteria to
No,
go by?
I mean, the only thing that really is limited to them if they're doing the work on the equipment is just being able to fit on the equipment. In
Okay.
terms of doing the mat exercises, Pilates was actually wanting to develop a program that could be put into all of the schools for the core strengthening. In terms of working on the equipment, I actually am working with a lot of preteens, like 11 to 13-year-old dancers right now,
Yes.
who are pre-professional dancers. And it's really, really helpful to them. So anyone who is young and athletic, all the way up, I mean, I've had kids literally at 13 years old come in with soccer injuries or dance injuries, and I've had people that are in their 80s.
Yeah, that was my last question.
Yeah,
was,
absolutely, the whole
the
spectrum.
whole spectrum. Okay,
Absolutely.
someone with osteoporosis, an elderly person, still safe to do that, comfortable for the
Yeah,
most
I mean,
part.
we would want to know what the level and degree of osteoporosis is, but we've certainly worked with people who have neurological issues such as Parkinson's and MS. It's been found to be very beneficial to that.
Great.
Really good for working on balance issues with seniors, really good for working on developing good muscle tone.
Great.
So, yeah, there's no limit to who can do it.
That's awesome.
Cool.
Marilyn, thank you so much for being on the show. It was very informative, wonderful.
My pleasure.
Thank you for being so attentive, and we look forward to seeing you on the next show.